8 warning signs of stomach cancer. If your stomach looked like this, how would you even know? Stomach cancer, also known as gastric cancer, can have a variety of symptoms. Here are 8 signs that may indicate stomach cancer. 1. Persistent stomach pain. Persistent stomach pain that is continuous and unexplained can be one of the most common and concerning signs of stomach cancer. This type of pain is often described as a discomfort or ache in the stomach area, which may not necessarily be a sharp pain, but is continuous and seems to have no clear, immediate cause. Unlike the occasional stomach ache that can result from a variety of benign conditions, such as indigestion, gassy stomach, or stomach viruses, the stomach pain associated with cancer is persistent and does not improve with standard remedies or over time. The characteristics of stomach pain that may be linked to cancer can vary from person to person. Some may experience a dull, gnawing ache that persists, while others might report a feeling of pressure or fullness in the upper abdomen, even when they have not eaten much. The pain may be more noticeable after eating or when lying down. In some cases, the discomfort might be mild initially and gradually become more intense as the cancer progresses. This symptom is particularly concerning when it is accompanied by other warning signs of stomach cancer. The reason behind the pain can be the growth of the tumor itself, which may cause a blockage or interfere with the normal functioning of the stomach, leading to discomfort and pain. It's crucial to note that stomach pain is a common symptom for many conditions, many of which are not serious. However, when the pain is persistent, unexplained, and does not respond to general treatment or lifestyle changes, it's important to seek medical attention. A healthcare professional can conduct a thorough evaluation, which may include physical examinations, imaging tests like endoscopy or CT scans, and laboratory tests to determine the cause of the pain and to rule out or confirm the presence of stomach cancer or other conditions. 2. Difficulty swallowing. Dysphagia. Difficulty swallowing, medically known as dysphagia, is a condition where one feels like food is sticking in their throat or chest, making it hard to swallow. This can start as a mild inconvenience, but may progress to a point where swallowing liquids becomes difficult. In the context of stomach cancer, particularly when the cancer is located in the upper part of the stomach, or at the gastroesophageal junction, where the esophagus meets the stomach, dysphagia can be a significant symptom. This area is crucial for the passage of food, and a tumor in this region can obstruct the pathway, making it hard for food to pass through. At first, dysphagia might only occur with solid foods, causing a sensation of food being stuck in the throat or chest. As the tumor grows or the condition worsens, even swallowing liquids can become challenging. This symptom is particularly concerning because it often indicates that the cancer is at an advanced stage. Difficulty swallowing associated with cancer might also be accompanied by pain or discomfort during swallowing, odynophagia, worsening indigestion, or regurgitation of food. If someone experiences persistent dysphagia, especially in combination with other symptoms, it's crucial to seek medical attention promptly. If you find these tips helpful, we encourage you to show your support by liking this content, subscribing to our channel, and enabling notifications for the latest health and nutrition tips. 3. Unintentional weight loss. Unintentional weight loss refers to losing weight without making changes to your diet or physical activity level that would normally explain the loss. When weight loss is significant, meaning a loss of 5% or more of body weight within a 6 to 12-month period, without trying, it can be a concerning symptom and a potential indicator of various health issues, including stomach cancer. In the context of stomach cancer, unintentional weight loss can occur for several reasons. Cancer can affect the body's metabolism, leading to a decreased appetite and a reduced desire to eat. Tumors in the stomach may physically reduce the stomach's capacity or produce substances that make a person feel full sooner. As mentioned previously, symptoms such as dysphagia, difficulty swallowing, or pain upon eating can make the process of eating uncomfortable and difficult. This can lead to a reduction in food intake and subsequent weight loss. Stomach cancer can affect the stomach's ability to digest and absorb nutrients effectively. Even if a person is eating, they may not be able to absorb all the nutrients from their food, leading to weight loss. Cancer cells can alter the way the body uses energy. The body may burn calories at a faster rate than usual, leading to weight loss. Additionally, the body might increase its energy expenditure as it works harder to fight off the cancer. Cancer often produces substances that change the way the body handles fats, proteins, and carbohydrates, potentially leading to weight loss. This systemic effect of cancer on the body's metabolism can contribute to weight loss even before the cancer becomes large or spreads. Unintentional weight loss due to stomach cancer is particularly concerning because it can be a sign of advanced disease. It's important to understand that unintentional weight loss can also be a symptom of many other conditions, not just cancer. These can include gastrointestinal disorders, thyroid problems, diabetes, infections, and other malignancies. 4. Nausea and vomiting. Persistent nausea and vomiting are symptoms that can significantly affect an individual's quality of life and overall health. When these symptoms are ongoing, and particularly when accompanied by the presence of blood, they warrant immediate medical attention, as they can be indicative of serious underlying conditions, including stomach cancer. A tumor located near the stomach's outlet, the pylorus, can physically block food from passing into the small intestine, leading to vomiting. Large tumors, or those that grow inward, can also reduce the stomach's capacity, causing nausea and vomiting, even with small amounts of food intake. Stomach cancer can cause changes in the body's metabolism and hormonal balance, affecting the brain's vomiting center and leading to nausea and vomiting. These changes can make the stomach more sensitive to irritation and distension. The presence of blood in vomit, hematemesis, can be a direct consequence of stomach cancer eroding into blood vessels, leading to bleeding within the stomach. This can cause the vomit to have a coffee ground appearance or be visibly bloody. Bleeding within the gastrointestinal tract is a serious condition that can lead to anemia and requires immediate medical attention. 5. Blood in stool or black stool. The presence of blood in the stool or black, tarry stools, medically known as melena, is a significant symptom that can indicate bleeding within the gastrointestinal, GI tract. This type of bleeding can occur for various reasons, including peptic ulcers, gastritis, and gastrointestinal cancers, such as stomach cancer. When the bleeding is due to stomach cancer, it's usually because the tumor has eroded into a blood vessel, causing blood to leak into the stomach contents. Blood that originates from the stomach or the upper part of the small intestine is exposed to stomach acids. This exposure causes the blood to partially digest and turn black, leading to black stools that have a tar-like appearance and a distinct, foul smell. This is different from fresh red blood in the stool, which typically indicates bleeding from the lower parts of the GI tract, such as the colon or rectum. The reasons behind bleeding in the context of stomach cancer include 1. Tumor erosion. As a stomach tumor grows, it can erode the lining of the stomach and invade nearby blood vessels, leading to bleeding. This bleeding can be slow, resulting in chronic blood loss that might not be immediately noticeable but can lead to anemia, or it can be rapid and significant, causing visible blood in the stool or vomit. 2. Ulceration. Stomach cancer can cause ulcers to form on the stomach lining, which can bleed. These ulcers are similar to peptic ulcers, but are caused by the cancerous growth rather than other common causes, such as Helicobacter pylori infection or anti-inflammatory drugs. 3. Advanced disease. In advanced stages, stomach cancer may invade deeper layers of the stomach wall and affect larger blood vessels, leading to more significant bleeding. Symptoms associated with bleeding in the stomach may include weakness, dizziness, shortness of breath, and pallor, pale skin, which are signs of anemia caused by chronic blood loss. In cases of significant bleeding, there may also be symptoms of shock, such as rapid heartbeat, low blood pressure, and even collapse, which require immediate medical attention. 6. Bloating. After eating. Persistent bloating after eating is a symptom that involves a feeling of fullness or swelling in the abdominal area. It's a common experience from time to time, often related to dietary choices or minor digestive issues. However, when bloating becomes persistent, occurring regularly after meals and not attributable to specific foods or eating habits, it may indicate an underlying health concern, including potential conditions like stomach cancer. In the context of stomach cancer, bloating can occur due to several mechanisms. 1. Tumor growth. A tumor in the stomach or near the pyloric valve, the passage between the stomach and the small intestine, can physically obstruct the passage of food, leading to a buildup of food and gas in the stomach. This accumulation can cause the stomach to expand, resulting in bloating. 2. Delayed gastric emptying. Stomach cancer can affect the stomach's ability to empty its contents into the small intestine properly. This delay can lead to fermentation of undigested food by bacteria, producing gas and causing bloating. 3. Ascites. In more advanced stages, stomach cancer can lead to the development of ascites, which is the accumulation of fluid in the abdominal cavity. While ascites itself is not bloating, the increased fluid can cause the abdomen to swell, mimicking the sensation of bloating. 4. Altered gut motility. Cancer and its treatments can affect the nerves and muscles that control the gastrointestinal tract's movement. Changes in gut motility can lead to an imbalance in intestinal gas, contributing to bloating. 5. Inflammatory response. The presence of a tumor can trigger an inflammatory response in the stomach and surrounding tissues, leading to swelling and a sensation of bloating. Persistent bloating, especially when not typical for an individual, warrants attention because it can impact eating habits, leading to unintentional weight loss or malnutrition. It's also uncomfortable and can significantly affect quality of life. 7. Indigestion or heartburn. Indigestion and heartburn are common gastrointestinal symptoms that most people experience at some point. Indigestion, also known as dyspepsia, is characterized by discomfort or pain in the upper abdomen, often accompanied by bloating, belching, and nausea. Heartburn is a distinct symptom involving a burning sensation behind the breastbone, typically after eating, caused by acid refluxing back into the esophagus. While these symptoms are frequently related to benign conditions such as acid reflux or gastroesophageal reflux disease, GERD, persistent or severe cases that do not respond to usual treatment may indicate a more serious underlying condition, including stomach cancer. Tumors located near the gastroesophageal junction can directly interfere with the normal functioning of the lower esophageal sphincter, the muscle that prevents stomach acid from refluxing back into the esophagus. This can cause symptoms of heartburn and acid reflux. Stomach cancer can affect the stomach's ability to empty properly, leading to an accumulation of stomach contents and increased pressure within the stomach. This pressure can push contents back into the esophagus, causing heartburn and indigestion. The presence of a tumor can cause inflammation in the stomach lining, leading to changes in acid production or the development of ulcers. These changes can contribute to symptoms of indigestion and discomfort. As a tumor grows, it can physically obstruct the passage of food through the stomach, leading to feelings of fullness, bloating, and symptoms of indigestion. Additionally, the tumor itself may cause irritation and inflammation, contributing to discomfort and heartburn. Persistent or severe indigestion and heartburn that do not respond to standard treatments, such as antacids, H2 blockers, or proton pump inhibitors, especially when accompanied by other symptoms like weight loss, difficulty swallowing, or gastrointestinal bleeding, should prompt further medical evaluation. 8. Anemia. Anemia is a condition characterized by a decrease in the number of red blood cells, or the amount of hemoglobin in the blood, leading to reduced oxygen transport to the body's tissues. This reduction in oxygen delivery can cause symptoms such as fatigue, weakness, shortness of breath, and pale skin. Anemia is a common complication in individuals with stomach cancer, and it can arise through several mechanisms related to the disease. One of the most direct ways in which stomach cancer can lead to anemia is through chronic bleeding. Tumors in the stomach can erode the mucosal surface, leading to slow, often unnoticed bleeding into the gastrointestinal tract. This chronic blood loss depletes the body's iron stores, as iron is a key component of hemoglobin, the molecule within red blood cells that carries oxygen. Over time, this iron deficiency results in the production of fewer and smaller red blood cells, a condition known as microcytic anemia. Stomach cancer can interfere with the absorption of essential nutrients from the diet, including iron, vitamin B12, and folate, all of which are crucial for red blood cell production. Tumors or surgery affecting the stomach can disrupt the normal absorption process, leading to deficiencies and, consequently, anemia. This type of anemia can occur in chronic illnesses, including cancer, where inflammation interferes with the body's ability to use stored iron and produce erythropoietin, a hormone that stimulates red blood cell production in the bone marrow. Although iron is present in the body, it is not effectively utilized, leading to anemia. Advanced or metastatic stomach cancer, as well as certain treatments for cancer, such as chemotherapy, can affect the bone marrow's ability to produce blood cells, a condition known as myelosuppression. This results in decreased production of not only red blood cells, but also white blood cells and platelets. It's important to remember that these symptoms can be caused by many different conditions, most of which are not cancer. However, if you have persistent symptoms or concerns, it's crucial to consult a healthcare professional for an accurate diagnosis and appropriate treatment. Thank you for watching 8 warning signs of stomach cancer on Healthy Vibrance. Don't forget to like, subscribe, and turn on notifications for more health-related content. See you in the next video.